Um, I am now going to, we're now going to move into the first workshop. So it is my pleasure to introduce the moderator of that workshop, my colleague, Dr. Catherine Freeland. Dr. Freeland is the Associate Director of Public Health Research at the Hepatitis B Foundation. She has been guiding our Philadelphia and Africa work for quite a few years now, and in fact has just helped launch the African Hepatitis B Advocacy Coalition last year with SOLDA, the Liver Society of Africa. It now has over 200 partner members across 25 countries, and she also leads our Hep B United Philadelphia Coalition. So I am happy to turn it over to Catherine.
Thank you so much, Frank. And we'll have to share that recipe back with the person who submitted it so they can make sure to give you feedback. But I'm thrilled today to be here with you all. Nice to see everyone. And today we're going to be jumping off the summit with a workshop on increasing screening, testing, and integration for hepatitis B. As we go through today's presentation, I would like to invite you all to provide comments in the chat using the chat feature in your Zoom panel, and also submit any questions throughout the duration of the session. We will have an opportunity to ask questions to our speaker at the end. And so I would love to be able to provide that Q&A and audience interaction throughout. I'd now like to introduce and welcome our first speaker who will be leading us in today's session, Zinnia Dong, who works as the Viral Hepatitis and Tuberculosis Program Associate at Northeast Medical Services in the San Francisco Bay Area, which also is commonly called NEMS, and it has been a longtime member of Hep B United and openly shares their knowledge with the coalition. Zinnia joined NEMS in 2017 and has since led multiple organizational improvement projects related to population health management, and is currently involved in implementing and evaluating hepatitis B elimination and tuberculosis prevention efforts at NEMS. So I'd like to hand it over to Zinnia. Welcome.
Thank you. Thank you for the introduction. Okay, great. Hi, everybody. My name is Zinnia Dong. I'm the Viral Hepatitis and Tuberculosis Program Associate at NEMS. And today I'll be sharing a little bit about NEMS hepatitis B screening efforts and some of the efforts leading up to our current screening rate and how things are. All right, please, next slide. Okay, so to give a little bit of background first to those who are not familiar with our health center, NEMS stands for Northeast Medical Services. We are a nonprofit community health center and federally qualified health center serving the San Francisco Bay Area. And we also opened up a clinic in Las Vegas 2 years ago. We see about 82,000 patients on an annual basis. And a little bit about our patient demographics. A majority of our patients identify as Asian, better served in a language other than English. About 3/4 have Medicaid insurance, 7% are uninsured, and a little over a quarter are 65 years and older. Next slide, please. So NEMS offers pretty robust primary care services, including lab site or lab draw at most of our clinical sites, as well as pharmacy and other services that you see on the screen. So we like to refer to NEMS as a one-stop shop for comprehensive health services. Next slide, please. Okay, so now a bit about Hep B at NEMS. So we do serve a patient population who are disproportionately impacted by hepatitis B infection. About 1 in 3 adult patients at NEMS were infected with Hep B in their lifetime, and that's evidenced through a positive Hep B core antibody. About 1 in 12 adult patients at NEMS have chronic Hep B infection, and many did not know they were infected actually until they were tested by a NEMS provider. Today, we have about an 87%, Hep B screening rate. And that was achieved through multiple efforts over the years, which I'll go into in subsequent slides. So how I am going to approach this presentation today is sort of sharing the foundational layers to which have supported our Hep B screening at NEMS, as well as Hep B management in primary care at NEMS, but mostly focusing on Hep B screening. So kind of at the base foundation is the organizational focus. And then I'll go into having a provider champion, provider education, our electronic health record tools, and then ultimately our patient outreach efforts. So about 6+ years ago, NEMS leadership recognized that we needed to do more focused work in Hep B and TB, both diseases that disproportionately impact our patient community. And so they decided to fund a provider champion role as well as a team of staff members focusing on these two diseases that disproportionately impact our patient population. And through that, you can go to the next slide, please. We have a provider champion. So Dr. Amy Tang joined NEMS around 2019, I want to say. Yes. She is our director of viral hepatitis and tuberculosis programs. She is the third person from the left. And this is our team of community health workers. We have a research coordinator and including myself on the left as the program associate for our team. Next slide, please. It's kind of hard to see, and that's okay because it's really just kind of this image is mostly trying to showcase the robust framework that we have at NEMS for Hep B elimination efforts. And at the top left corner, our roadmap to Hep B elimination at NEMS starts with universal Hep B screening with the 3 serologies. And for a while now, even prior to Dr. Tang joining, providers did understand that Hep B was a disease that disproportionately impact our patients, and they would do Hep B screening. But with Dr. Tang joining, there really is a movement to do universal adult screening for Hep B with the 3 serologies. And you can also see kind of towards, the left and or right of this box, we also have other Hep B management services that we really tried to focus on in primary care. Next slide. In addition to having an organization-wide Hep B provider champion, each of our large clinical sites also have a site-specific Hep B provider champion. And most of the people in this hepatitis B C elimination program committee are primary care providers. We also have like an OBGYN provider and a pediatrics provider. Oh, sorry, I meant to say adult medicine provider. But yes, each of our large sites have a specific Hep B site provider champion. And they're also members of the Hepatitis B C Elimination Program Committee, also known as the HEP Committee. This committee meets on a bi-monthly basis, and providers receive additional Hep B training. And at this committee, they also discuss interesting Hep B and C cases. And I really wanted to mention this because having local provider champions reinforce the importance of identifying Hep B in our patient population and also provide providers at those sites with a go-to person if they have any questions about how to manage a patient's Hep B. So now I'm going to move into provider education. So we have our organization-wide provider champion. We also have site provider champions. And so now it's also really important to make sure that our other providers are equipped with managing Hep B in our primary care setting. So all new adult medicine providers will receive a special orientation when they first onboard to review the simplified hepatitis B guidance for primary care providers. So Dr. Tang meets with them on a one-on-one basis. It's usually about an hour long to go over this document and kind of emphasizing once again how prevalent Hep B is in our patient population and the importance of identifying it early, but also highlighting the potential impact they have at our health center with Hep B management. And then also, oh, sorry, one more thing to mention from the previous slide is that on an annual basis, providers will also receive kind of an update to hepatitis B guidelines or other new information that is relevant to Hep B to help them with their care. So Dr. Tang will give these presentations, which is attended by our adult medicine, pediatrics, and OBGYN providers. Moving on to electronic health record tools, it's really important to make things easier for providers. And so in late 2023, NEMS transitioned to the Epic EHR system. And because our leadership team understood the importance of reducing health disparities that are specific to our population, we were lucky to get the version of Epic where we are able to customize our EHR builds. And so we created this custom hepatitis B screening care gap. And a care gap is something that shows up on a patient's storyboard. Like when you open up their chart, you can see on the left side, these are all the recommendations for the patients that are that have not been done yet. So we have one for hepatitis B screening. The logic is for everybody all adults age 18 and older who do not have a documented hepatitis B surface antigen test results, they will be recommended a one-time hepatitis B screening. And there's some buttons that you might be able to see next to the Hep B screening care gap. So providers are able to order the labs directly from this care gap. And when they select the order button, it automatically defaults to ordering the triple panel. The Hep B surface antigen, Hep B surface antibody, and Hep B core antibody, we really want to make sure that we have a comprehensive assessment of our patient's hepatitis B status. And let's say that they don't, if providers don't order directly from the care gap, they can still order from like the lab module. And we also have it set up in a way where it's sort of whenever you order the Hep B screening, it also defaults to ordering the triple panel. So just really trying to make sure that one, things are easy for providers to order, and two, that it's clear to providers that we really encourage them to order the triple panel. Let's see if there's anything else I want to say here. No, I think that's it. Okay, next slide, please. And then lastly, so if providers don't get around to ordering the labs, if they don't see the care gap, we have our safety net, which is on a quarterly basis. Our community health workers will outreach to patients to encourage them to get screened for hepatitis B. And you might also see we also will encourage patients to get screened for hepatitis C and tuberculosis if they have not been screened before. We figured if we're already reaching out to the patient, we might as well try to get the patient screened for these other diseases that they might have, but no one is reaching out to them about yet. So we do this screening or do this outreach on a quarterly basis through electronic communications via the EHR systems like messaging, patient portal. If patients are not signed up for that, we will just mail them a letter. And once those communications have been sent out, if the patients don't call in to schedule their appointment with our community health worker, or they schedule the lab appointment, they can do it through our community health worker line. If they don't do that, our community health workers will outreach to them via phone call. So this is meant to be sort of like a safety net to make sure that we really try to make sure everybody gets screened. These Written communications are available in English, Chinese, Vietnamese, and Spanish. And we also have language concordant community health workers, which is great. I think there's one more slide. Yes. And then lastly, I just want to mention we do offer free hepatitis B screening to our community. So if someone is not a NEMS member or NEMS patient, being a member is totally free. But if they're not a NEMS member, they can still get free hepatitis B screening at NEMS, as well as hepatitis C screening and tuberculosis screening. We also offer this free screening program to our patients who are uninsured. These flyers get distributed to the community at outreach events and health fairs, and we are also very thankful for our partnerships with like SF Hep B Free, who also really help distribute these flyers to the community. And when patients get screened at the community health fair, we also want to make sure that they know what their results are. So we have also customized result letters in English, Chinese, Vietnamese, and Spanish, which we will mail to the community members once we have their results so that they are aware. And so I think that brings me to the end of my presentation. Hopefully, you got a little taste of what Hep B screening efforts have been like at NEMS. And I think we go into the Q&A section.